Hey guys, so it's me again. I just wanted to make an updated video about my jaw surgery. Um, in my last video, I just said that I was gonna, try and keep you guys up to date on what's going on. Um, I tried my best. Well, today is day 15 after surgery. 15 days since I had my lower jaw surgery. Um, and the reason for it being done so later on is because I was just healing, like it took me time to heal. I was trying to do a 1 week post-op video last week, obviously, but my energy was just not there. I was still in pain. I was still trying to heal. I just wasn't there, like physically. I was just so tired and still in so much pain last week. So I just wasn't in the mood to make a 1 week video update. But yes, today is 15 days since I had lower jaw surgery, and I was in a good mood. Today I felt really good. Today is Friday, June 14th, and on Tuesday, this past Tuesday, I had a visit with my surgeon, my doctor, and he said everything looks good. My bite looks good. I know in my last video I talked a little funny because of my open bite, but yeah, this is my bite now. I'm really happy with how it came out. And in my first video, my last video, I mentioned how I was getting a sagittal split osteotomy done and a genioplasty done to my chin. I did get the sagittal split osteotomy done, but I did not get the genioplasty done. And the reason for that is because my insurance couldn't cover the genioplasty. They covered the sagittal split, they just couldn't cover the genioplasty because they considered it cosmetic. And I couldn't pay for that myself. I couldn't pay for the genioplasty myself because it was $10,000 and I don't have that kind of money. So, but I mean, I'm still happy. I mean, I was a little bummed that I couldn't get it done, but I mean, I'm good with what I got, I mean, this is what I mainly needed done, my bite. Now my teeth can finally touch. I'm so happy. They haven't been able to do that in such a long time, and I'm just so glad it's finally done. I'll just explain a little bit of what went on after surgery. Well, during surgery and after. Anyway, Thursday morning, May 30th, I was scheduled to go in at 10, and my surgery was supposed to start at noon. So I got there at 10 a.m. I went there with both my parents. Went in, checked in. They got all my insurance information, and after that, they called me into a little room, and I changed into a hospital gown. They let me keep my underwear on, my boxer briefs on, which was good. I didn't want to be, walking around naked in a hospital gown. So yeah, they let me keep my underwear on. I went into a small room, changed in there, and then I sat in this big comfy chair, and they allowed my parents to come in and sit with me. And as I sat there, my parents and I just talked, and then a nurse came in, and she gave me an IV, and I was a little nervous about that, but I got it done. I got the IV put in. My mom was just so scared, so nervous for me, and that she asked them to give me aromatherapy. And if you're not familiar with aromatherapy, it was like this thing that they stuck onto my hospital gown, and it just let off this like really amazing aroma of lavender. It smelled so good. Anyway, so I did that. and then she put in some type of like, I forget what it's called, but she put it into my IV thing, and I was nervous. I was so scared before the surgery, but after she inserted whatever that was into my IV thing, I just relaxed. I calmed down. I was just like, ready. I was ready to get the surgery done. I was actually more excited to go to sleep, like just to get the anesthesia and go to sleep. That's what I was really excited and looking forward to after they inserted the thing to calm me down or whatever that was. After she inserted that into my IV, I barely remember what happened after that. I think they put me on a wheelchair, and then wheeled me into the operating room. But I barely remember. What I do remember is two doctors worked on me. One doctor did this side, another doctor did this side, and I remember being wheeled in right to the operating bed where I was gonna be, and one of the doctors was saying hi to me. That's what I do remember. I do remember that, and I remember them lifting me out of the chair, but my energy and my strength was just gone. I couldn't even lift myself up out of the wheelchair. I needed their assistance, and I do remember them lifting me up. But I also remember my breathing being very short. I needed assistance to breathe. But I mean, it wasn't that big of a deal. I could still breathe. It was just, the thing they gave me calmed my breathing. So I remember barely being able to catch my breath. I got tired out so easy from that. But I mean, it wasn't that big of a deal. Anyway, I remember them lifting me up out of the wheelchair, setting me on the operating table, and then laying me down gently. And then I remember just laying there looking up at the ceiling, and then one of the nurses was saying, "Okay, Ricky, we're gonna give you the anesthesia so you can go to sleep now." And then she set this thing on my nose, and then I took a deep breath, and then I was out. The next thing you know, I woke up in the recovery room, and I had pain going through my lower jaw. And I remember a nurse saying, "Hello, Ricky, how do you feel if you..." And I couldn't speak. My whole mouth was bandaged shut, and I could not talk to her. So she kind of laughed a little and was like, "I'm sorry, give me a number 1 through 10 on where your pain level is." And I gave her a 9 because my whole jaw was just throbbing. And she was like, okay, I'm gonna give you a little more medicine, and then you tell me how you feel in 10 minutes. So I nodded my head yes, and she put the medicine in my IV, and then the pain started to go down. My pain level started to go down, but I was still probably at a 6. So she gave me a little more, and that felt a whole lot better. And next thing you know, I went back to bed. I went back to sleep. And then I remember being wheeled on the gurney that I was on into a room where I could rest. And yeah, I remember just being wheeled down a hallway, and then one of the nurses was like, "Ricky, your parents are here, there's your dad." And it was so calming and relieving for me to see my dad, and my dad was, "Yeah, son, you did it," and when my dad said that, it was just, it finally hit me. I did it. I got the surgery done. It's done, it's complete. I don't have to be scared no more. I'm fine. So I was so relieved, and it was so heartwarming to see my dad there. And anyway, they wheel me into my room, and my mom comes in, and I felt so much better. hearing my mom's voice and seeing her, but I was still like really sleepy and really tired. So like I was just trying to go back to sleep. But then 2 nurses came in and they were like, Ricky, we need to move you on to the gurney next to you so you can rest better. So we're gonna move you over to the next gurney. So that's what they did, and they were like trying to tell me to slide my body over, but I could not do it. Like my energy, my strength was just, I felt so weak, but I did it. And then yeah, they got me into my hospital bed where I rested for the night, and everything was all good. I slept on and off throughout the night. The nurses there were amazing. They took really good care of me, and my parents left for the night. They needed to get home to be with my nieces and nephews, my younger siblings. So I stayed in the hospital overnight alone, but it wasn't bad. I watched TV. I just rested, because that's all I wanted to do. I just slept. The next day I woke up, and then my surgeon came in to see me, and when I fully woke up, like realized where I was, like I noticed I had like a tube taped onto my nose, and it was weird. I was like, what is this thing, And the nurse came in and he was like, Ricky, we're gonna give you some juice. We want you to drink it, and we're gonna see how you feel in a half hour. Let us know if you feel nauseous or anything. So I was like, okay. So I drank the juice, and when I drank it, it was hard to swallow. It felt like I had like a sore throat. But I thought like it was because my mouth was open during surgery that like it dried out. But no, that wasn't the case. The tube coming out of my nose was actually like going down my throat as well, into my stomach. And it was to drain the blood because they didn't want me to puke up blood after my surgery, which is a good thing. I'm so thankful they did that. I didn't want to like puke up blood, so I'm so glad they did that. But what sucked though was when they had to pull it out. I was scared because the tube was so far down my stomach, I wasn't sure if it was going to hurt or not. So my doctor said, do you feel nauseous? Do you feel okay? I'm like, yeah, I feel fine. And they're like, okay, well, we're going to pull the tube out of your nose. So I braced myself, and as he pulled the tube out, it was a really long tube. Like, as he pulled it out, I could feel it coming up my stomach. And I wanted to gag, but I couldn't. It was like the weirdest feeling. And then I felt it come up my throat. And then the ugly part about it was when it finally came from my nose, it felt like my nose was being scratched on the inside. And as he pulled it out, I was just, like so uncomfortable. It was such an uncomfortable feeling. But he got it out, and I could swallow like so much better. It felt way better. I could breathe better, and yeah, so that was that. Anyway, long story short, I'm kind of rambling on. This video was long enough already. But I came home. I got to the hospital that day, and then I went to go see my surgeon at his office, and then only one of the surgeons was there. I had 2. I remember I said I had 2 surgeons. Only one of them was there, and I had like these tubes going into these other tubes going into my mouth to drain most of the blood from there as well. And when he took those out, it was horrible. It was such a horrible pain, like, because when I got my surgery done, the nerves that run through your chin right here, mine weren't damaged or anything. Mine were just stretched just a little, but no damage was done, thankfully. But the thing is I could feel pain here. And when he pulled those 2 tubes out that were draining the blood, it was horrible. It was painful, and I tried my best not to cry, but I did. I'm not ashamed to say that. I did cry when they pulled those tubes out, because, it was painful. I'm gonna be honest with you, it was painful, but I got through it. I was okay. Like 15 minutes later, I was okay. Then yeah, they just told me to take it easy, rest, be on a liquid diet, and I came home. And let me be honest with you as well, the first 4 days were horrible for me. They were so bad. Like, I was in terrible pain. The first 3 days anyway, I should say. The first 3 days were terrible because I only took ibuprofen. I was scared to take the heavy stuff, the strong stuff, because you hear about all these opioid addictions and all that, and I was not about to do that. So I avoid taking the strong stuff. But on the third night, I was just like, screw it. Screw this. I need this heavy medication. This pain is unbearable. So I finally took the strong stuff, and I felt amazing. Like, that pain went away. My body felt so relaxed. I felt amazing. Like, I was pretty much high, but it felt so good, and I was finally able to get a good night's rest. Those first 3 nights I could not sleep well, but after I took that medicine, I slept like a baby. So yeah, there's that. And the first week was tough. The first 7 days, I have to say, were tough. Days 8, 9, 10, 11 got better, and now it's day 15. And I'm doing much better, so much better. I like my bite. And I actually feel more confident being in front of the camera. A lot of the swelling has gone down. There's still some, I don't know if you can tell, but there is still some swelling. So yeah, there's that. I'm still healing. I'm still taking it easy. The only thing I would say that sucks for me is, the liquid diet. I hate the liquid diet. It's killing me. I'm only on week 2. Yeah, 2 weeks into the liquid diet, and I already want a burger or steak or something. But this past Tuesday, I got cleared to work out. So that was good. For sure, after I was told that, I went directly to the gym. I finally got 2 workouts done, one on Wednesday and one today, and I feel amazing. I feel like I'm getting back to my normal self, and I don't regret it. I don't regret the surgery at all. The first 3 days, obviously, I did, because those are the worst few days, and they told me that too. The doctors told me the first few days are the hardest, but I'm getting better every single day, and I don't regret the surgery. So yeah, I guess that's about it. This video is really long. It's really, really long, so I'm gonna end it here. But if you guys have any questions or want to know anything, just leave them in the comment section. As for numbness, I can feel this side up until here, and then right here I can kind of feel it, but not really. And then from, I would say, here to here is numb. I can't feel that. I mean, I can, but not entirely. But from here to probably from here to here, it's numb. Right here. I mean, I can kind of feel this, but not completely. But the doctors did say there was no severe damage done. There was no damage done to the nerves, so my feeling should be coming back. I'm not sure when, but they did say it was gonna come back. I can kind of lick my lips now, but it's not normal like I used to. But yeah, Anyway, I'm gonna end the video here because this is super long and I rambled on forever. But yeah, I like the results. I just can't wait till the swelling goes down. But yeah, jawline's looking better. I like it. I'm happy. Anyway, I'm gonna end it here. Again, if you have questions, leave them in the comment section and I will do my best to help anyone else who's going through this or who needs to get this done. And yeah, just let me know what you want to know. Alright, thanks. Bye.